Hi, welcome to Demystifying Medicaid with Dr. Krish. Thank you for spending some time with us as we try to navigate this really complex healthcare system. So I'm a pediatrician, and when a child comes into my clinic, we get to discuss a few things. We ask about the pain and the problems, and we want to fix that. But we also make sure to ask about where a child lives. Where do they work? Where do they spend their time, and where do they play? And boy, will children share their stories. We know that 70% of health is comprised not in what happens in that clinic or in a healthcare environment, but what happens in the environment around us, the food we eat, the air we breathe, the social determinants of health. There is a movement around the country that is starting to ask of Medicaid and of insurance more generally, how do we invest in the lives of folks to keep them healthy, to keep them out of the hospital? And I am joined today by a friend, a hero really, who is at the forefront of shaping how this is done. It's my great honor to welcome Dr. Nate Chomolo, who is the Medicaid Medical Director for the state of Minnesota. Nate, thanks so much for coming and joining us today.
Thanks for having me, Dr. Krish.
Yeah, so Nate, Dr. Chomolo, you are a successful pediatrician, a successful physician. You have touched the lives of a lot of your patients in community. What made you decide to take on a role like this, being the state Medicaid medical director? What made you decide to make that transition?
It's a great question. Question I'm asked a lot. And so we're actually coming up on like 5 years ago when I was starting to kind of mold this decision more seriously. And I went into medicine with kind of some general ideas. I wanted to become a pediatrician, wanted to serve kids and families. But I also saw how my dad moved through our Cameroon immigrant community as a resource. He was a pharmacist, my mom's a nurse. And so folks would often ask them questions about their medicines or what they're hearing from their doctors. And they were really trying to figure out how to navigate our healthcare system. And so I wanted to go to medical school to become a doctor to help folks in my clinic, but I also wanted to help my community in the ways I saw my parents and others really helping folks navigate the healthcare system. And so that led me to a path of doing a number of types of what folks call advocacy or community organizing around particularly early childhood, and started getting involved in organizations like one that we are both passionate about, Reach Out and Read, which helps promote early literacy in the clinic. And that got me into spaces where I was talking more at a state level. I was talking to folks interested in early child care and interested in seeing how we can get folks ready to succeed in school, and the systems need to for that. And so all that came to kind of a head when I was realizing, kids don't have access to healthcare, families don't have access to healthcare. They have a lot harder time getting access to these resources, which we know make an impact on their health. And as someone who is starting to learn more and more myself about health disparities, structural racism in healthcare, knowing that so many of the disparities we see in adults and even older kids and adults, they start really early as well. And so how do kids who are young get access to healthcare? A lot of it is through Medicaid, right? And so really thinking about then what are the levers we have in our system where healthcare services are driven by how we pay for them a lot of times, and being able to work at the state in a way that you're able to really have some of these conversations, reflect with colleagues about their role in structural racism and inequity and how we can actually do better, stop contributing to damage and do things to prevent damage and promote healing. And so that's what I said, hey, I'm interested in this role if we could do these things, and if we could have these conversations, if we could really center communities that have been historically impacted by structural racism, if we could really look at the opportunity we have before birth and in those first 5 years, I think I'm your guy. And the state was interested in, and I had some wise advice from a good mentor of mine, I think a friend we both share, Dr. Julia Joseph DiCaprio, who said, I think it would be a great opportunity if they're willing to do that and go for it. And we're here almost 5 years later, and happy I made the decision.
Well, what a journey! What a story! And it's awesome to have advocates like you at that state level. So tell me a little bit, what does the state do? What does the state do to make sure people have coverage and make sure people have health care?
Yeah, so folks, get access traditionally to doctors through having health insurance. That's how we've set it up in our country, and folks historically have gotten health insurance through their jobs, but that wasn't reaching everyone. And so, way back in 1965, they passed legislation to create Medicaid and Medicare. And I like to start there because people often will kind of interchange the two. So Medicare is the system that has been set up. It's run by the federal government, and it's for our elders. So you just qualify by the fact of your age, 65 and up. Automatically, there's some folks that you can qualify for earlier with certain conditions, but generally it's you're 65 and up. Medicaid is a program for folks who have lower incomes, and so they're unlikely to either get insurance through the jobs or be able to afford insurance, even if their job offers it. And so that is a state and federal government program. And so the federal government sets some kind of big, requirements, but states get to choose, outside of those requirements if they're going to do more or less. And so that is where the state really comes into play, is because Medicaid looks really different if you're in Minnesota than if you're in Wisconsin or in Iowa or North Dakota or California or Oregon or Alabama. So the state really has a lot of leverage to be more responsive, and some states kind of look at it as something they have to do, and some states look at it as something they get to do, quite frankly. And I think Minnesota has been one of the ones that has been more proactive in looking at how we get to do it. And so we set things like eligibility and how much or how little money you make, which qualifies you. We set things like which benefits you get access to. We said things like how those benefits get paid to providers to hopefully help increase access. And so being able to then really shift and try new things. So often Medicaid will try things before insurers for commercial or insurance that you get through your job tries things, and then systems will start to respond to that. So one example I always point to is things like, in my clinic, fluoride, which is a treatment that really helps prevent cavities in kids. And being able to provide that in clinic, Medicaid required it, and so the clinic just started doing it for everyone, regardless of whether you had Medicaid or commercial insurance or no insurance. And so there's an opportunity to really shift practice there. And then when you get down to just how it impacts our communities, when you look across the state, roughly 60% of folks get their coverage through employer sponsored insurance or through their jobs, and about 15 to 20% get their coverage through Medicaid specifically. But that's more for kids, right? About 40% of kids across the state get their coverage from Medicaid.
Gotcha.
And then when you look at communities by color, folks who identify as Black, about 40% of all Black Minnesotans get their coverage through Medicaid, about 60% of children, and about 80% of mothers or expecting persons get their coverage through Medicaid. When you look at American Indians, numbers are very similar. About 60% of kids, 90% of women are expecting persons. And so really when you think about how we reach folks and the ability to really address some of these longstanding racial inequities, Medicaid and the state have a large role to play in kind of structuring the systems that deliver those care.
So you talked a lot in your vision, and you're a visionary, and you talked in your vision about getting out into community, about getting healthcare out into community. How does the state try to get health insurance out into community? How does it sort of advertise that we have it, that people can get it? What are the efforts the state takes there?
Yeah, I think these have really ramped up since the Affordable Care Act in particular. And so one thing the Affordable Care Act did was create state exchange, or give the opportunity to create state exchanges for folks, again, if they made maybe too much money to qualify for Medicaid but not enough to afford their insurance, they could apply through a network online. In Minnesota, it's called MinnesotaCare. And so when that opportunity came about, we need to get the word out so folks knew. And so there's enrollment navigators that have existed for some time, but it really infused a lot of energy and resources into actually getting the word out, meeting people where they're at, helping them navigate and see what type of health insurance they qualified for. And that's primarily for the last 10, 15 years now been how the state really engages around health insurance. I think one thing we saw with the COVID-19 pandemic, where we changed some of our policies and just had people continue to stay enrolled in Medicaid regardless of having to fill out paperwork, is that we actually saw a 30% increase
Wow.
in the number of Minnesotans who were on our Medicaid program. And so when we went back to our kind of old rules, we wanted to kind of say, how can we do a better job talking not just about kind of health insurance, more broadly, but really reaching folks that we know are eligible, but we're dropping off because of some of these kind of red tape, paperwork burden hurdles. And so we've over the last year been working with lots of different partners, doing listening sessions with community about what are some of the barriers, what's some of the tools that can help, like just knowing how to look up your status, knowing when which piece of mail that comes is the one you need to fill out.
Absolutely.
Right. So we put like a blue badge on the envelope and so when you see the blue, it's time to renew. Having different resources by different language, but also by different community messengers. Sometimes doctors aren't always the best ones to be carrying a message.
Yeah,
we learned that in the pandemic. Sometimes folks from the state aren't the best ones. Maybe it's folks in your faith community. Maybe it's the organization that's been helping you find housing already,
Yes.
or navigating getting food that also can then help connect you to this. We've been working with childcare, Head Start as well. And so really thinking about how we can better, schools are another great place to actually connect with folks. And so really thinking about how we can better meet people where they're at to get them connected to the coverage, because we know it makes a difference. When you lose coverage, you're more likely to miss medications, you're more likely to miss checkups, vaccinations, or shots, and you're more likely to experience adverse health outcomes, contribute to the disparities that we see in our state today.
This really is back to your roots of community organizing and getting healthcare out. We think a lot about insurance. I think, if I get sick, and I end up at the hospital, I want to have insurance. That's kind of the way, at least the way I think about it. But there's a lot more to it. There's this whole world of prevention and keeping people healthy. Can you talk a little bit more about how either insurance helps with that or the state helps with that and helps us think about that?
Yeah, and I really like to think about it through a life course perspective, right? And so, it even starts before, you are conceived, right?
Yeah.
The health of your parents really can impact your health and whether or not you're born early or you're born low weight. And so even thinking about how adults and young adults in particular who are thinking about starting a family or might not be thinking about it, but it's coming their way, what are they getting the health that they need? Are they getting the screenings for preventable cancers? Are they getting the screenings for things like diabetes or heart disease or high cholesterol? Are they getting guidance on healthy behaviors as far as moderation of alcohol, cigarettes, things like that? All these things contribute to then, all right, you're on your way, and what is the health care that your mother, the person that birthed you, what are they receiving? And we know that the more prenatal care you get, the more likely we're able to catch preventable things. And I think that's one thing, we really try to hone in on is, health care. There's things that we know we can prevent and we can do. And so it's not just about kind of doing a test to do a test. It's because we often have treatments, we often have therapies that we can step in and help keep your health before it gets off track. And so then you arrive and you're that bundle of joy. And so healthcare then is also about checking in on you, making sure that you're growing. And again, as pediatricians, we know, as dads, we know that there's so much that happens in those first several years in particular, and that if we again catch things early, we're able to give kids the chance to stay on their best trajectory and reach their full potential. If we let things wait and wait and wait, then it gets harder to get them back on that full trajectory and that full potential. And in addition, you're also thinking about how do you help the parents, right? That's another thing. I think any parent will tell you, the advice that they get from their pediatrician and their parent or their grandparent. Yeah. There's probably some differences around things about sleeping and there's new shots available. What's going on with that? And so being able to have the best up-to-date advice and be able to have those options and opportunities, starts with having consistent access to care, going in for those regular visits, even when things seem like they're going well, being able to catch that. And then as we get into our older kids, into our young adults, being able to, again, have access to information to keep us healthy, when there are still some vaccinations that we recommend, there are still ways to prevent chronic diseases that we want to make sure folks are aware of. And then as folks do age develop certain diseases, chronic diseases, how do we manage those and maintain our full spectrum of abilities, be able to work and do the things that we want to do. And then as we transition into an status as an elder, there are increased risks to our health, making sure we're getting the right cancer screenings, making sure that we have all the resources to stay in the community and stay with our family as long as possible. And that's really the goal, is right, health and full lives. And I think we have a lot of advances in our society, in our country, but not everyone has the same access to them. And I think that's part of it is because the way that we've structured it. Part of it's because when people show up to our clinics, they don't all get treated the same, and they feel that and know that, and they talk about that. And so I think there's a lot of opportunity for us to do better so that everyone has that kind of full opportunity for health and to be able to live their fullest lives.
Well, I really love the way you frame out that life course path. And I think a lot of people think about, I only need insurance when I'm sick. But really what you're pointing a picture is that this kind of insurance, whether it's Medicaid, MinnesotaCare, can actually support throughout the life course.
Absolutely, absolutely.
How has public health insurance sort of evolved over time? And you've been in this role now 4 years or so. How has it evolved in your time there? And then how do you see it evolving?
Yeah, I mean, I think just even the language around it continues to evolve. It was kind of initially for the indigent, or thinking it was a lot focused on kind of elders and folks who were viewed as not able to provide for themselves, right? And it's really shifted over time as we've seen, particularly the benefit to covering more children, and understanding how many of our children and young families in particular are navigating poverty, to really see it as an actual benefit that helps support health, helps support a number of sectors, really. There's some evidence of Medicaid specifically, kids who are covered by Medicaid, more likely to not miss class, more likely to graduate from high school, more likely to go on and graduate from college, more likely to pay taxes, more likely to not end up needing public assistance themselves, right? And so really seeing it as a path to success, part of that American dream, really, ideally. But there's still some, folks out there that look at it as something that, there's people trying to take advantage of it, when really there's no evidence, of that. And so I like to kind of name that, but then also push back against that, quite abruptly. And I'd say that transition too has kind of thought about, all right, well, are we doing the best to help folks get connected, or are we looking at it as a service that we want to try to kind of keep as many folks off of as well? Gotcha. And so there's been conversations about things like work requirements and other policies to try to limit folks' access to it, versus the other side is, how do we actually keep folks more connected? And so particularly in the last several years, we talked a little bit about, with the pandemic, Congress passed policies to just keep everyone on it during the acute phase of the COVID-19 pandemic, because you didn't want anyone losing health insurance in the midst of a global pandemic, right?
Absolutely.
That makes a lot of sense. And so, with that, we saw that the rates of folks coming on and off, significantly decreased. We saw racial disparities in that churn of folks coming on and off significantly decreased, or pretty much be eliminated. And so there's been a recent movement to say, hey, why don't we actually take something that we learned from the pandemic and continue that? And so what's one of the things that we've done here in Minnesota, following the footsteps of other states like Oregon, which putting forth policies that would expand continuous coverage for kids in those first 6 years of life, for example. Also, continuous coverage instead of having mothers and birthing persons after they give birth lose their coverage within 2 months. We've extended it to 12 months, having at least 12 months for sure postpartum coverage. And so I think some of the shifts there are again, seeing more and more it as a benefit, something that helps us as a society be stronger, as a way to really help address some of these disparities that have developed over time, instead of having to think of just this, thing that we have to worry about.
Yeah. Would you mind commenting a little bit? I mean, clearly there's a lot of evolution of the program, and you're pushing things forward at the state level. How do you see Medicaid, maybe healthcare more generally, interfacing with these other areas that we talked about before? Housing, transportation, food, food security. How do you sort of see that relationship, and what are you thinking there in terms of how the state can interface?
Yeah, and so you kind of alluded to them as kind of the social determinants or social drivers of health is another term that I like to use. And what you noted at the top there is we know health doesn't happen just in the clinics or in the hospitals, it happens so many other places. And so if we have a program that really is supposed to be dedicated to promoting our community members' health, how can Medicaid then support health not just in clinics and not just in hospitals, but out in the community as well? And so knowing that there's a unique opportunity when folks are in front of a doctor, in front of a clinician, to understand what impact things like housing or lacking access to food or transportation is having on their health, and then meeting that need there while you have them there in front of you. And so Medicaid as a payer, then our job is to figure out, right, well, how do we pay for that? How do we pay for the time to screen and do it well? Because you can actually do harm, right, if you're asking these questions in a way that isn't really thinking about experienced trauma and lived trauma that associated with it. So how do we pay for it to be done the right way? And then how do we make sure it's accessible, particularly to folks we know experience these gaps disproportionately, right? And really being intentional about rolling it out, making sure the folks that might be providing assistance for housing, providing assistance for transportation, stocking the food shelves, that they're actually located in near communities where we know that they're impacted most. And we have access to data to see how the health of our members is going through the claims that are submitted by providers, and so that gives us a starting place to then go have further conversation. And that's the kind of path that I look at my work is using the data as a starter, but then you go and talk to community and how does this impact you? What has worked well that we should be paying more for or paying more attention to? What's been a barrier that we can potentially get out of the way that has just kind of we've always done it because we've always done it, and really challenge that notion. And so when it comes to things like social drivers of health, I think there's a lot of opportunity to be a listener and then also be a convener because there are a lot of great services being already provided. Some by our plans partners, some by local public health or state public health, some by our schools, or the healthcare systems themselves. And so how can we actually then be a better convener, be the ones that are looking across the state, understanding what's already working, being a better connector, and then also lifting up kind of best practice and sharing that with folks.
That's what a great opportunity I think you, the state, and we all as a healthcare community have. Dr. Tromolo, some of our neighbors are out there right now, and they either are afraid to go to the doctor because of insurance issues, or they don't have insurance. They're concerned about insurance. It makes them nervous, makes them worried. Do you have any advice for them? Any thoughts for them?
Yeah. So I would say one great place to start is our community health centers, particularly our very qualified health centers. They're really the best set up as kind of a one-stop shop, right now. These are health centers that get funding from the federal government, as well as payment through insurers, but they are set up so that they usually have a sliding fee scale. So if you can't afford it, they're not going to charge you. If you can afford a little, you'll get a little, and then they also have folks there that can help connect you to health insurance and help you understand what you have access to. They usually have folks there who can also provide behavioral health services. They can provide dental care. They can do all those screenings, and they're often more and more, not just in their own health centers, but they're also out in the community, at schools and other places as well. There's some of them have mobile units, as well, and so I think they're a great model. They're also governed by community members that they serve, which I think gives them a real unique and needed perspective about the needs of community. And so I really say that's a great place to start. And then there's always opportunity, from there, if you get connected to health insurance, kind of understanding, what other opportunities you have. If you want to keep your care there, great, but you also then can have opportunity to go elsewhere. But there are a lot of benefits. There's a lot of folks out there looking to help. Your county usually also is a great place to start to get an understanding of what additional resources you might have at the county level. If you're in bigger cities like Minneapolis, St. Paul, Bloomington, they should also have health departments that can also help connect you to a lot of resources. So there's a lot of help out there. And really encourage folks to kind of engage because again, we can do a lot more if we catch things early and keep you healthy. I often talk to kids about why do we talk about wearing helmets, right? Right, and that's because if you fall and break your arm or your legs, we can fix that. But if you break your head, sometimes we can fix it, sometimes we can't, right? And that's with a lot of health things. If we have something to protect us, that goes a lot further. But if we break it, sometimes it's hard to get it back. So let's try to keep us, whole and healthy, and take advantage of a lot of the resources that are out there. And I think that that's another thing is Minnesota often gets ranked as one of the top states in the country for healthcare, but it's not experienced by everyone the same. And some of that is because folks don't feel welcome. Some of that is folks just don't know, what they have a right to and have access to. And so, I'm glad you're doing this work, that Giletta's doing this work to get the word out, because the more we know, the more we can make the decisions that keep us healthy.
Dr. Chomolo, we are so grateful for what you do for our little ones and for our community every day. And now for your leadership at the state, having visionaries like yourself, pushing us, challenging us, and guiding us on where to go. It's a great benefit to all our neighbors. And so thank you for your time today. We are so grateful. Everyone, we have spent this entire podcast trying to demystify Medicaid. But there's more you may want to learn. To learn more, we would encourage you to go to MinSure.org. And if this show has been helpful to you, there are more episodes. Check them out at hennepinhealth.org/podcast. Like it, share them with your loved ones, share them with anyone who you think might need it. Everyone has a choice of how they spend their time. Thank you for choosing to spend it with us. Stay well and be well.